Good afternoon. Randall Wolf here. I'm a heart surgeon at DEBAKEY Heart and Vascular Center. This is DEBAKEY CV Live. We have a really interesting program for you. It'll take about 45 minutes, and we're going to talk about atrial fibrillation, procedure called the mini maze, which is a procedure that we do here at Houston Methodist. I'm part of the DEBAKEY group, and I specialize in arrhythmia procedures. I'm really pleased to introduce to all of you a former patient, a current patient, and also a healthcare provider who knows a lot about medicine and also suffered from atrial fibrillation. So she's very knowledgeable as both a patient and also as a healthcare provider. Her name is Sandy Schrameyer. She lives in Wisconsin. She also has a home in Michigan. She goes back and forth between the two. She has become really an expert in atrial fibrillation too, based on her experience and all the homework that she's done. She has a very interesting story to tell us. Sandy, thank you for joining us on DEBAKEY CV Live this afternoon, and welcome to the program.
Nice to see you again, Dr. Wolf.
I thought it might be a good idea just to start from the beginning. I think people will want to watch this who maybe are suffering from AFib. They or one of their loved ones suffers from AFib. They'd like to get some knowledge. There's lots of information out there on the internet, but information, as we know, is not knowledge, and knowledge is not wisdom. And if you go to the internet, you get information. You don't get a lot of knowledge. You get precious little wisdom. So through this program on CV Live, we're going to help people who are navigating their own AFib course, not just give them some knowledge, but also maybe give them some of that precious wisdom. So if you would, maybe I think people could relate to your story. So maybe you should start from the beginning and tell people what you've been through, what your journey's been.
Okay, perfect. First of all, I am a nurse, but I'm not a cardiology major. And so when I was diagnosed with AFib, I had a lot of learning to do. I had to go back to the books and really do a lot of research. But I would say I probably had AFib maybe 8 years before I was diagnosed. I had an incident where I had some irregular heartbeats for a while and kind of blew it off. Didn't really think it was anything until I kind of couldn't ignore it anymore. I didn't have it for maybe a year or so. And then in 1 year, I had one maybe 6 months apart. So finally, I went to a cardiologist and he said, we could put a monitor on you, but we probably wouldn't catch it. It's probably not a big deal. Ladies your age are probably more anxious than anything. Maybe just try to get your anxiety in control. So I did that. And then it kind of got to the point where—
Let me interrupt you just for a second. And for our listeners, the questions were, it was up on the board there. There is a number. You can text 37607, type in DEBAKEY if you have a question. So you can you text DEBAKEY to 37607 and you text in your message, and we will take questions live during this presentation if you'd like to and you're listening live. Otherwise, you can respond to me at wolfminimaze.com or to DEBAKEY about any questions you have about AFib. And the direct number, my number at DEBAKEY is 713-441-5307. But I think it's better you can go to, right now, if you have a question during the presentation, you can do the text to 37607 and type in DEBAKEY and your question, or you can also go to wolfminimaze.com. So you may see that come up on the screen from time to time, and that's if you'd like to talk to us during this 45-minute presentation. Okay, Sandy, that's some housekeeping rules. Go ahead.
Okay, sure.
So you were, and what, by the way, what you said is very common. I see patients in the office and I say, how long have you had AFib? And they go, well, do you mean diagnosed or how long have I had symptoms? And many of them will say, I've had symptoms looking back on it for years. I just would have palpitations and they'd go away and I'd go about my business. I've had patients come to me and say, I've had this since high school, but finally it got to the point where I had episodes that lasted hours, days, or I got into AFib, I couldn't get out. So go ahead.
Well, that's kind of what happened with me. And then when I finally then really pressured and went in again, he said, you're having anxiety attacks. And I think you need to be on an anti-anxiety medication, Lexapro or something. And I'm not one to take medications. I said, no, I'm not doing that. And I went home and then I started having PACs. And they kind of got pretty persistent.
Tell our listening viewers what that is.
Those are pre-atrial contractions where instead of having AFib beating fast and regular, I would feel like a fish was flopping in my chest, or you would feel like you had a skipped beat, and it would be a harder beat, would be the second beat. And I was getting those pretty often. And one day I was at work and I had one of our nurse anesthetists run a strip on me, and I took it up to
By strip, you mean an EKG?
An EKG strip, right? And I took it up to the cardiologist. He says, yep, normal sinus rhythm with PACs. Okay, fine. So that we left it at that. And then it seemed to settle down a little bit, but I still had an irregular pulse. And I just happened to have an appointment with my internist, my regular yearly exam. And I went in and he was feeling my pulse. And I said, oh, you're going to feel an irregular pulse. I've been having a little problem with that. And he was listening to my chest. And then he was listening a little longer than I felt comfortable with. And he said, Sandy, we're going to do an EKG. And he's the one that actually diagnosed my AFib. So he set me up with an internist, an electrophysiologist, an EP. And naturally, I had my first visit, walked out of there with the typical meds and a beta blocker, an antiarrhythmic, and a blood thinner, and an appointment to have an ablation. So I had 2 cardioversions.
The physicians will tell the patient, you have AFib, you're going to have it for the rest of your life. They give you really dire news and just say you're going to be on blood thinners the rest of your life. You just have to live with it.
Which is exactly what I was told. But I pushed for the ablation, actually. And at that point, I would have done anything or taken anything to get rid of it. I hadn't done a lot of research yet. And I was the good little patient. And I took my medications. And I went in and I had my first ablation. And stopped the meds after the 3 or 4 months. And my AFib came back with a vengeance. Worse than it was prior to even having an ablation.
That's an important statement because I hear that very often also. I was talking to one gentleman who's a very famous ex-NBA player, and he had a catheter ablation. And after that, he was so much worse, nobody could even talk him in to any procedure after that.
Well, unfortunately, I did. I got talked into 2 more, but I did. So I went back for the second ablation, and again, AFib returned. And by then, I'm not a depressed person. I have a pretty happy-go-lucky personality. The meds were slowly killing me. And he said, let me do 1 more ablation. We'll try this. Every time I would go in the office, I was in tears. And I had an NP actually look at me one time and say, I can't believe you're this depressed over having AFib. There's got to be something else going on in your life. And I nearly got up and walked out of the office. But anyway, had the 3rd ablation. They had upped my meds. When I got done, I was taking a stronger beta blocker, stronger anti-flecainide. And I couldn't function. I wasn't surviving. I wasn't living. I was just surviving.
That's another really important point. Patients tell me that their medications were changed and slowly increased over time to the point where they could hardly get through to noon. They wanted to lie down on the couch and go to sleep. And after the mini maze, patients would tell me, I feel better than I have for years. And I'm thinking, why do they feel okay? You're back in rhythm. You should feel better. But they say, no, better than years. It had dawned on me after several years, it wasn't just getting back in rhythm. It was also getting off some of these drugs. And you mentioned flecainide, which is a very strong antiarrhythmic. And most of these drugs that patients are put on are very strong medications. Sotalol is very strong. People get so weak they can't get through the day. So I think it's not only getting back in rhythm, but also getting off some of these pretty dangerous drugs.
Well, the beta blocker, well, I couldn't function. My blood pressure and my pulse were in the tank. They were so low. And so I called the NP and she said, well, you need to get off the beta blocker. She said, just stop taking the beta blocker. So I did. And within a week, I was in permanent aflutter. So I had to go in for a cardioversion. And then I learned that you really shouldn't be on an arrhythmic without taking a beta blocker, that one excites and one calms and they work together. So I had to have
just for our listeners, a cardioversion is where you are sedated and usually outpatient center to the point where you're asleep, and then you get a shock to try to get the heart back in rhythm.
And then after that, the doctor came in and told me that my next step would be an AV node ablation and a pacemaker. And
we should talk about that for a second, because this is a very common path that you were asked to go on, which is we can't do anything more for you. You've had 3 failed ablations. The only thing we can do is ablate your own pacemaker. So you no longer have your own pacemaker for the rest of your life. And then we put in a pacemaker and you'll be totally dependent upon an electronic pacemaker. But what sometimes patients don't understand is they will still be in AFib and they will still have the risk of stroke. So an AV node ablation and a pacemaker doesn't stop AFib.
No, the risk of stroke and the risk of dementia down the line and the risk of congestive heart failure. And by that point, I had done a little bit of my own studying, and I knew that a pacemaker should only be used for somebody with very slow heart rates or somebody that has very long pauses. And it should not be used to treat AFib. So I just basically looked at him and said, that's not going to happen. And I walked out of the office and I knew that there was a better way, and it was going to be up to me to figure out what that was. So I started doing my own research, which led me to you and the mini maze. I did everything I could. I studied everything I could about the mini maze, everything I could about you. And then I made the call that changed my life. And I called you and you talked with me. And I said, I told you my story and hoped that I would be a candidate for your mini maze. And you said you thought you could help me, but you would have to see my records. And the conference was coming up in Dallas that year. And it was in about 6 weeks. And I said, I'm going to come down and meet you and listen to your program. And that's where it went. And I came to
for our listeners, that's Melanie Truehill's
correct
Stop AFib conference, which is going to be virtual this year, by the way. And it's a conference held in Dallas. It's been held there for maybe 6 years, something like that.
I still go every year.
And it's very helpful. It's very intensive 2.5 days of lectures from experts in the field of atrial fibrillation, everything from blood thinners to catheter ablation to things like the mini maze. At the time that you attended, which was a few years ago, it was still a live conference. It's usually 150 to 250 people in attendance. Most people that have been battling with AFib, many who've had failed ablations, and even some that have had the pacemaker and AV node ablation, and then they realize they still have AFib. So anyway, you attended this conference in Dallas.
And I have to just tell you the quick story. When I got there, there's always a meet and greet the night before. And there were 5 other people, and we just kind of got to chatting and told each other our stories. And I was the only one of the 5 of us who had had anything done already. And they were there not having had anything done, trying to find their answer and what it would be. So we all sat together at the table, and we listened to the EPs. There were probably 6 or 8 EPs there, electrophysiologists.
Electrophysiologists.
Correct. You were the only cardiac surgeon. And I might add that electrophysiologists, EPs, cannot do the mini maze. It has to be done by a cardiac surgeon. So we all listened to the EPs get up and talk about their ablations and their medications, and that you still have to take a blood thinner for the rest of your life because the LAA is not addressed. And then we listened to you
talk about... The LAA is the left atrial appendage, where most clots start in the heart with AFib.
Correct. And then we listened to you talk about the mini maze and that we would be able to get off all medications. And then you clamp off the left atrial appendage. So we never have to take a blood thinner again or an aspirin, anything like that. And they all looked at me and said, well, this gives us the best chance of being AFib free and taking no medications. It's kind of a no-brainer. So the very next, I think it was within the next couple of months, they all started coming down one by one from their respective states to Houston to have you do the mini maze. And then I was the last to have it done, because essentially when I came to the conference that year, I was only 5 months out from my third ablation. And sometimes they can go out maybe a year to total healing. And I was hoping that that is what was going to happen, but that wasn't the case. So I came down and had mine. And I might add, all 5 of us, all 6 of us, including myself, are friends to this day. We're still in contact, and we are all AFib free and take no medications. So it was a win-win for all of us. So
that's a great story, and I didn't think of it from that standpoint. We're batting 1,000, 6 for 6. That's great. And these are people from the East Coast,
California, Virginia, Nevada,
Washington area. Yeah.
Yep.
Coast, from East Coast to West Coast and in between.
Yeah, for sure.
That's right. And then an interesting side point is that Rusty came, or not, Ross came back and at one of the following conferences, and we showed him skydiving after having the mini maze. And if you can do that and not get AFib, I think that's about the best stress test you can have. We showed that clip at one of the following meetings of him skydiving, not having AFib anymore.
I just talked with him the other day. He's still skydiving.
He had 2 problems because he was a pilot.
Correct.
And AFib and being a pilot don't go together very well. So he was very happy when he could get back up in the air, not only be a pilot, but also jump out of the plane. Not a plane that he was flying, but as a passenger.
Yeah.
So let's look back on this now and think about this for a minute. Let me see what and say, okay, the first question that a person who's watching this webcast might ask is, if you had to do it all over again, would you do anything differently?
Yeah, I would have. I wish I would have found you first prior to having 3 failed ablations. I believe in being aggressive soon when you still have a chance of healing it once before you get persistent or permanent. I mean, then you can't do anything anymore. But
you can. We can. We've done patients that have been in continuous AFib for 5 years and still had them AFib free for 10 years.
That's great.
An example is Colonel Chuck Miller, who had continuous AFib for 3 years, had an ejection fraction of 15%. For our viewers, that's a very low heart output. Mm-hmm. He discussed with his doctors going on the transplant list for a heart transplant. And he came to me, he's a very smart guy, retired Air Force colonel, and said, I think my main problem is AFib. I don't think I need a heart transplant. I think I need to get back into rhythm. And he had already had bypass surgery, so he was a pretty special case. He had his mini maze 10 years ago. He's still in rhythm.
Yeah, well, I hope to be too.
Ejection fraction went from 15% to 53%.
Yeah.
So, but generally, you're right. The longer you go out of rhythm, the harder it is to get back into rhythm. Now, from a patient standpoint, take off your medical specialist hat and put on your patient hat. And in your opinion, why don't people think about the more aggressive approach more early on?
Because I think that there's more EPs out there than there are cardiac surgeons, especially doing the mini maze. And I think that the ablation is a standard of care. I mean, that seems to be what they do, and the medications. And I don't know. I think people, my big thing is you need to be your own healthcare advocate, and you can't just take everything at face value for what you're told to do. I did that at first. I would never do it again. That's just my, and I wanted to talk a little bit about recovery. My recovery, usually any recovery for any ablation or even the mini maze, is 3 to 6 months. Mine went out a full year. And it wasn't because of anything with the mini maze. It wasn't with anything with my recovery. It was my anxiety was sky high. And anybody who has AFib or atrial flutter knows that anxiety will throw you into an attack. And I truly, truly believe I had PTSD, post-traumatic stress disorder, from having 3 failed ablations in a very short period of time. I had 3 ablations in 1 year. I had one in February, I had one in October, and I had one again in February. So it essentially, I was preparing for a surgery, had the surgery, in the blanking period for the surgery, and then having AFib come back. And then I was preparing for another one, again, healing, had it come back. And I did that 3 times. And I truly, so I kept waiting for the mini maze to fail. And my anxiety level was just, I know I called you several times and you had to tell me, Sandy, I had a flutter. I had flutter. And we even thought I was going to have a flutter ablation. And then finally, after, and you kept saying no, because I just needed to hear it wasn't AFib. And you kept saying, no, Sandy, it's a flutter. And if we need to, a little short 20-minute ablation will help, we'll totally erase this and you'll be fine. But I needed to learn that the AFib was gone and I need to get rid of my anxiety. I haven't had a flutter in well over a year. I feel amazing. I feel better than I did 20 years ago. So that was...
For our listeners, atrial flutter and atrial fibrillation are 2 different rhythms. They're both arrhythmias. They're both supraventricular, which means the top of the heart, not the bottom chambers, but the 2 top chambers. In atrial fibrillation, the 2 top chambers are just wiggling, no beating.
Okay.
In atrial flutter, the 2 top chambers are beating, but they're beating faster than the lower chambers. So the 2 top chambers are beating maybe 300 beats per minute, and the lower chambers are beating 150 beats a minute, or it could be 300 to 75. Mm-hmm. And many patients have both AFib and A-flutter. Generally, what is manifested is atrial fibrillation. And if the atrial fibrillation can be treated successfully, usually after a while, the atrial flutter goes away. Atrial flutter, by the way, is a very, very common complication of catheter ablation.
I had to be cardioverted after each of my...
on atrial flutter after catheter ablation.
Yeah.
What's that?
I had to be cardioverted after each of the ablations that I had. And I do know that sometimes you can have a little atrial flutter even after your mini maze, because when you fix one arrhythmia, another one kind of tries to sneak through, and that's usually a flutter. But generally it passes. And mine probably would have if my anxiety level could have been decreased. And
I don't think so. I disagree.
Okay.
Left atrial flutter is harder to treat than AFib.
Okay.
Because it's iatrogenic. It's created by the catheter ablation.
Okay. Okay.
So it's very difficult to treat. But fortunately, we found out that the mini maze treats left atrial flutter after a catheter ablation very well. And what we found is, even though after catheter ablation, electrophysiologist says the pulmonary veins are completely isolated, if we look on the outside of the heart during the mini maze, the veins are not isolated.
Okay.
And promotes the flutter. So by doing a complete isolation of the pulmonary veins with the mini maze, we eliminate the left atrial flutter. So in fact, we found that it treats left atrial flutter very nicely. That is the mini maze procedure. Another thing that we found out that I think is very important in many patient situations, and especially your own, is that your AFib may be triggered by anxiety. Mm-hmm. And this is called vagal AFib. It's based on the vagus nerve, which goes down from your neck, right down around your heart, and then it goes down to your stomach. Vagal stimulation can cause ulcers. Anxiety can lead to stomach ulcers. That's the vagus nerve. The vagus nerve also can cause AFib. It turns out these vagal fibers, which are on the outside of the heart, not the inside of the heart, so you cannot reach them with a catheter ablation, but you can reach them with the mini maze. So I developed the procedure where we test these vagal nerve branches. And if they're positive, we burn these little branches. Therefore, we make vagal AFib disappear.
Mm-hmm.
That can't be done with a catheter ablation.
No.
And that's one of the reasons why the mini maze is so successful. If the vagal stimulation is causing the AFib, we take care of that because we ablate the nerves, we test the nerves, we don't stop ablating the nerves until we've tested that they don't fire anymore. We close the left atrial appendage, which can also be the source of the atrial fibrillation, which the cardiologist can't get to.
Right.
You can't ablate inside the appendage very well. EPs gave up on that because of the complications. We treat that on every case. So of the three mechanisms of AFib, vagal AFib, yes, we treat that because we get to the nerves on the outside of the heart. If there's anything on the inside of the heart where the pulmonary veins are, we treat that much better than they can with catheter ablation. And thirdly, if the AFib is from the appendage, well, we treat that too. So we treated all three potential causes of AFib. Two of those which can't be reached with a catheter ablation, and the third one, pulmonary vein ablation, is not done very well with a catheter yet today. So those are some of the differences, and I believe that most people with lone AFib, lone meaning you don't have underlying coronary disease or heart failure, most people that have standalone AFib have vagal AFib just like you had. Mm-hmm. And now I think regardless of your anxiety, you can't make yourself go into AFib.
No. And it's amazing. I feel so much better. And, there's an AFib forum where I kind of stay on. And I know there's maybe just a handful of people on there that still will comment who have had the mini maze, because people do so well. They leave the forum because they don't need the support anymore of a support group. But I stay on, and I do it for three reasons. Number one, I'll always be an AFib patient, and I want to stay current. That's why I come to the conference every year as well. And number two, I have a son-in-law with AFib. He's had a couple of ablations and he's doing okay, but he's been having some problems with some atrial flutter, as you know. And if his AFib comes back, he's on a plane to Houston to see you as well. And number three, the nurse in me, I think, just still wants to heal the world. And I read these people suffering. They're pouring their heart out on the forum, and they just want somebody to help them. And it's like the meds are killing them, and they're going for their third, their fourth, their fifth, their sixth ablation. And occasionally I put my story out there, and people have said, I put out there that I'm AFib free. I take no medications. And well, what did you do? And I said, I had a mini maze. Well, what is that? Nobody knows what it is. And I said, okay, well, PM me, and they'll PM me, and I'll talk about it. And I know quite a few people have contacted you and have actually had your procedure. Or every once in a while, I'll say, have you ever thought about a mini maze? And what's that? So we've talked. And so a lot of people have had it, even just from that. And so I get these people messaging me all the time, telling me how well they're doing. And no one is having AFib. No one that I've talked to, and none of our group has. So, they're all doing super. It's just.
And they're not on blood thinners. I might mention here that for most of my patients who can have it, I put in a continuous monitor under the skin. I use the Link device, LINQ, that's made by Medtronic, and it allows me to review the heart rhythm of all my patients after the mini maze on a monthly basis, but also it can be activated at any time if patient has symptoms, and we can review it. And as far as I know, nobody else in the world does this. And the EPs don't do it. You had 3 ablations. Yeah. Did they put a link in?
I asked for one and I was denied.
Yeah, they don't want it. They don't want to know.
No.
But I do want to know, because we have very good results. So I follow 90% of my patients with the implanted monitor. This is not a pacemaker. It's a monitor. Right. And it allows us to make sure that the heart's staying in rhythm. And it checks every heartbeat for 3 to 4 years.
I have one.
It's very helpful.
I have one. It's just peace of mind too. It's peace of mind for me, just knowing it's there.
Right. You're right. It helps stop that post-traumatic stress disorder, doesn't it?
It sure does.
You're right. So I think I'm about the only one that does that. It's a local procedure that I do in the office about a week after the mini maze, and I can follow patients anywhere in the world. I have 2 patients that I follow in Guam, which is halfway around the world, and I see their link results just like I see Sandy's. For those of you who might just be joining us, we're talking with Sandy Schrameyer. She is a healthcare professional. She knows a lot about the AFib, both from as a patient and as a healthcare professional. She's been through it all. Sandy, if someone wants to get a hold of you, can you explain in a little more detail what your forum is? And also, I want to interject that people can also go to wolfminimaze.com, and that will put them in touch with me, and I can also put you in touch with Sandy. But Sandy, what is this site where you're very active, and you're kind of an AFib psychiatrist in a way?
I'm trying to look up what it is. It's actually it's Melanie's site, Debbie McCall, and she's the administrator of it, and it's Atrial Fibrillation Forum, AFib Forum. I probably won't be able. Here we go.
Yeah, go ahead and bring it up, because I think this is very important, because if you want to get in touch with Sandy and ergo me, this would be one way to do it. Sandy's helped a lot of people, and they have come to Houston. They've had a mini maze, and they've been happy, including some very difficult patients who've been through many terrible episodes and procedures, and they finally found a cure with the mini maze.
Yeah, I should have wrote.
You're very active on this one site.
Yeah, I should have wrote this down before. It's an AFib form. Right. Yeah, just let me find it here.
And I guess there are a lot of people with AFib on this site, right?
There are lots of people with AFib, and it's kind of sad, just to know what everybody's gone through.
So one thing you can do
it's called Atrial Fibrillation Support Group, and if you just put it in,
spell it out for everybody. Let's spell it out slowly.
Atrial Fibrillation. It's FIBRILLAITON Support Forum. And if you just put that at the top of your
Atrial Fibrillation
Support Forum. Correct. And if you just put it at the top.
Atrial Fibrillation Support Forum.
Correct. And then you can just put that at the top of your Facebook, and then just, if you go into that, it'll say join. All you have to do is join it. And then you can read all.
So you want to go to Facebook first?
Go to Facebook, and at the very top, there's that little bar where you can just write in the Atrial Fibrillation Support Forum. Correct.
Forum. Atrial Fibrillation Support Forum.
Correct. And then just click into it, and then it'll ask you to join. You just hit join.
And that's where they can find you.
They can ask for me. Sure. I post quite a bit. Schrameyer. SCHRAMEYER.
Say it again more slowly.
S as in Sam. CHRAMEYER. Schrameyer.
And for those of you who are curious, Sandy, tell them what your day job has been for years.
Well, I'm a registered nurse, and I was a labor and delivery nurse for 35 years. Loved it.
You've helped a lot of people.
I sure have.
For those of you who are watching this after the live, you can reach me at wolfminimaze.com. That's a website, WOLFMINIMAZE. This is a website that was started by one of my patients, George Raby. George was a VA patient. He had ablations. He was frustrated. He was a skydiving photographer, and a little bit like Ross, only he made money by photographing people who would skydive. So he put a camera on his head and jumped out of a plane and filmed other people jumping out of the plane. and he got grounded because of AFib. And after he found me somewhat like how you found me, and had the mini maze and got back up in the plane and was skydiving again, and was on live TV as a patient who no longer suffered from AFib. And he came back to me in December one year and said, "Doc, I got a present for you." I said, "George, you're in sinus rhythm. That's good enough present for me." He goes, "No, you need to get the word out there. Nobody knows what you're doing." And he said, "I want to start a website." And I said, "Okay, let's talk about it." He said, "No, I already did it." And he opened up his computer, and there it was, Wolf Mini Maze. Because what I was calling it before that was bilateral pulmonary vein isolation and occlusion of the left atrial appendage. And he said, "Doc, that's not going to fly." So he named it Wolf Mini Maze, and that site has evolved over the years, but he's the one I give credit for starting it and naming it. And it's still called Wolf, WOLF, Mini, MINI, Maze, like a mouse maze, MAZE. And he named it that after a procedure that was done by Jim Cox called the maze procedure, the Cox maze procedure. And since he thought it was a little bit like a maze, but was done through little incisions without the open heart surgery and the sternotomy and heart-lung machine, he called it Mini. So that's the genesis of the name of the website, which I had nothing to do with. But in retrospect, I think he did a pretty good job. So yeah, go ahead.
Okay, the one thing I wanted to say is, after that third ablation that I had, and I mean, emotionally, physically, anxiety-wise, I mean, I was at an all-time low. I mean, an all-time low, where I thought my life was never going to be the same again. And then I found you, and you gave me hope. Okay, and anybody that has AFib knows all we want is hope. The same thing when these people reach out to me on the forum, and I tell them about my story, and they say, "You've given me hope." And that my heart just sings, because that's how I felt. And so there is hope. You don't have to live this way. And I've said that on the forum. You don't have to live this way. I'm proof. I take no medications, none. I take vitamin D.
That's the gist of the whole thing. You're right.
It is.
Getting back to what we said when you first started your story, when they told you, well, you'll just have to be on blood thinners the rest of your life. You just have to be an AFib the rest of your life and have a pacemaker, and we're going to ablate your AV node. And you said no.
And that, and being told, this isn't going to kill you. AFib is not going to kill you. Okay, well, I just feel like I'm going to die every time I have an attack, but I understand, no, it's not going to kill me. But I mean, yeah.
They gave you no hope.
No.
They gave you no hope.
None.
That's the key.
None.
That is the key. And a lot of happiness is hope.
Absolutely.
And so you get hope, and then even if you haven't reached the finish line yet, you already are happier, right? Because a big part of happiness is hope.
Yep.
And so what we give people with Mini Maze, we give them hope, we give them happiness, we stop their AFib. Do you mind if I mention something else personally about you?
Go ahead.
You've also, after you got hope and happiness, you lost weight.
I did. Well, I'm trying to, yeah, I did. I lost a lot of weight.
And I told you last time I saw you, you're a very beautiful woman, and you've really shaped up.
Well,
I think maybe part of the way you've been able to do it is you have happiness and you can do things.
Let me tell you something though, okay? When you saw me, I was miserable, okay? I was still miserable. I no longer feel sad, angry, anxious, hopeless, depressed, or drugged. So, yes, I'm happy.
And then you started losing weight.
I did. I think
you may have a poor. Go ahead.
I didn't say anything. But
we
I
lost video connection for a second. So say that again.
I like I said, when you saw me, it wasn't truly me. I'm me now. I'm me again. And I'm happy. And I would do it again if I had to. But, and I will keep advocating because you don't have to live this way.
Did we go through all your notes?
I think so. I took my glasses
I
off.
think we covered a lot. I think you said it better than me. People with AFib want hope. You're there to tell them there is a way out. There is hope, route to happiness with AFib, but you have to do your homework.
Got to be your own
You have to
advocate.
look for options that may not be presented to you by your physician. The Wolf Mini Maze was not presented to you by your physician, even after 3 failed ablations.
Oh, no. No. And, and I understand. I went above his scope of care. I understand that. But I wasn't going to, I would be pacemaker dependent right now. And no, I wasn't, that isn't something that I didn't want to take those meds the rest of my life. There was no way. They weren't helping anyway. They were making things worse.
I don't agree with that completely. As a physician, I do believe it's our duty to present patients with all their options, not only the options that one person can deliver. As a surgeon, we're trained that way. You present the surgical options, but you also present the non-surgical options. Now, the surgeon doesn't make any money with the non-surgical options, but that's not my job. My job is to present all the options, ones that maybe I'll benefit from, but ones I don't benefit from. And I'm not sure that's always true on the other side. Sometimes physicians only present options that they can benefit from. But the key is for the patient to benefit, not for the physician to benefit. That's the difference.
Mm-hmm. I agree.
You agree with that?
I agree.
Yeah. Well, so for those out there that have been listening, we've been talking with Sandy Schrameyer. She's a great advocate. You can reach me, Dr. Wolf, at DEBAKEY Heart and Vascular Center in Houston, Texas. You can reach me through my own website named wolfminimaze.com. And you can reach my wonderful, beautiful advocate, who is both a healthcare professional and a patient, through Atrial Fibrillation
Support forum
on
Correct.
Facebook.
Correct.
That's where you'll find Sandy Schrameyer.
Yeah.
I think this has been very educational. We're a little bit over the 45-minute time. Is there any other way they could?
Sure, I'm willing to talk to.
Is this the best way for them to reach you?
Sure, I'm willing to talk to anyone, anytime, and share my experience.
Wisdom from Wisconsin, or
Okay.
also from Michigan when you're at your other home. But
the cabin,
we'll say it. Sandy Schrameyer, wisdom from Wisconsin.
Perfect.
Sandy, thank you not only for joining us on DEBAKEY CV Live on atrial fibrillation. What can you do? We didn't answer the specifics about who's a candidate, but I can say in summary that most people are. People say, what if I've had 3 ablations? That's okay. What if I've had 5 ablations? That's okay. What if I've had a stroke? That's okay. What if I've had previous surgery? That's okay. What if I've already had a pacemaker? That's okay. I'll talk to you. We'll look at her just like I did with Sandy.
I've had people reach out to me.
Everybody on a patient.
Yeah. I've had people reach out to me and I've had people reach out to me with something I couldn't answer. And I said, he'll have no problem talking to you. Just give him a call. So I didn't know if you could do it or not, but I figured you could certainly help them. So.
What's the site one more time?
Atrial
Fibrillation
Support Forum.
Okay, that sounds good.
And I think there's another one
too.
Listeners,
I hope you.
There's another one too called AFib Support. I'm sorry.
Atrial Fibrillation Support Forum.
Right, and there's another one too called AFib Support. But the other one is associated with the conference in Dallas. The admins on there
What
are
again?
the Atrial Fibrillation Support Forum is affiliated with the Dallas conference, the AFib conference.
StopAFib.org.
Right.
Yeah, okay. For those of you listening, if you have further questions, contact me or contact Sandy, wolfminimaze.com or Atrial Fibrillation Support Forum, or stopafib.org can also get you to Sandy or to me. We'll answer your questions. If I can help you, I will tell you so. If I don't think I can help you, I will tell you that. Thanks for joining us. This has been very educational for people that have AFib. Sandy, thanks for joining us today. And
You're
also
welcome.
thanks for your continued support on the forum.
Sure.
You probably helped more people than I have.
Doubt that. I doubt that. But
So that ends our conference today. Thank you for joining us through Houston Methodist and DEBAKEY CV Live.
bye.